Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
You have the medication, the patient is asking for it, everyone is waiting. But before you give anything, there are 5 simple questions every first aider and first responder should ask. Today we're talking about the 5 rights of medication administration, because medications can save lives, but only when they're given safely. So let's go through it. The first right is the right patient. Is this medication prescribed for this person, or is it clinically indicated in your clinical practice guidelines? Can you identify the patient using 2 identifiers? That might be their name or date of birth, because the right medication given to the wrong patient is still the wrong medication. The second right is the right medication. Always check the label, read it carefully, and make sure the medication in your hand matches the medication the patient needs. Similar packaging, similar names, maybe different dosages, and assumptions can lead to mistakes. The third is the right time. Some medications are taken at a prescribed time, others are given when clinically indicated. Sometimes there needs to be a certain time between medications. For example, a patient experiencing anaphylaxis may require adrenaline immediately. A person having paracetamol for a headache might have to wait a couple of hours because they've already had paracetamol 2 hours ago. A person having chest pain may require their prescribed angina medication when they're experiencing chest pain. So timing matters. The fourth right is the right dose. Check the prescribed dose. Follow the instructions on the packet. And if you're administering a medication as part of a first aid practice, always do what you've been trained to do, what you've been credentialed to do, local guidelines or organisational policies. More is not always better, and less may not be enough. And finally, the right route. How should the medication be given? Is it swallowed, ingested? Is it placed under their tongue, sublingually? Inhaled, given up the nose, intranasally? Or perhaps administered another way entirely? The route affects how quickly the medication works and how well it is absorbed. So, the right patient, the right medication, the right time, the right dose, the right route. 5 simple checks, 5 opportunities to prevent an error, because before you give any medication, just take a moment, ask the questions, double check the details, because giving the medication in the right way can save a life, and giving it the wrong way can change one.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.